Hi, my name is Taylor Kivell. I'm a senior in animal science here at Iowa State, and today I will be talking about equine herpes virus. As a horse owner myself, I know that the process of biosecurity within our country and horse facilities is not of the greatest importance when it comes in comparison to other livestock such as cattle and hogs. However, with the increasing risk of diseases affecting our horses such as EHV1, it is crucial that we start taking more action to keep our horses healthy and safe from harm. For those who may not be large travelers with their horses and may not have come across reading about EHV1, the acronym stands for Equine Herpes Virus Strain 1. This particular strand of the virus causes neurological disease and respiratory infections, as well as abortion, but that part will not be covered today in my presentation. Not only is it important what the virus can cause our horses to go through, but it is also important for us to understand how it is contracted and spread from equine to equine. Also, being able to understand its transferability allows us to look at the signs and how to treat it before it has detrimental effects to our animal. Recently, there has been an outbreak in the Midwest of EHV1 with confirmed cases in Minnesota, Wisconsin, and Iowa. As of March 7, 2014, at least 8 horses with an acute neurological disease had been diagnosed. 6 of these horses had been tested positive for the equine herpes virus strain 1. 3 were humanely euthanized, and the others are being treated on the farm. The most common symptoms recognized by the RAF of this virus is noticed within the respiratory system and the nervous system, particularly relating to the brain. If the horse has contracted the virus, you may not be able to observe symptoms until a stressor causes the activation of the virus. Some stressors have been related to this activation are periods of weaning, long transportation distances, and large amounts of extreme exercise activity. A big fraction of the horses that transmit this virus are affected by the forms of respiratory distress and neurological myoencephalopathies. In respiratory EHV1, the virus destroys the epithelium layers of the upper airway. However, the infection can also harm the endothelial cells that line the nervous system, especially around the brain. Some, but not all, horses that become infected with the virus can also be exposed to EHM, which is also known as Equine Herpesvirus-1. When equine becomes septic with EHM, blood vessel damage in the brain and spinal cord can occur and cause vasculitis and necrosis, and eventually lead to the death of the animal. Symptoms to look for when you suspect a horse might have EHM or EHV would be nasal discharge, ataxia, hind limb weakness, urinary incontinence, which is the inability to urinate, and the decrease in tail tone. With a viral disease that is as devastating as EHV1 can be, it is important for us to understand the transmission of the virus as well as the history of its occurrence. In the equine species, the transmission of EH1 is most commonly done by the shedding of mucosal epithelium tissue layers of the upper respiratory tract. The shedding of the layers can remain virulent up to 14 days outside the body, and clinical signs of infected animals tend to arise around 3 to 6 days post-contamination. The prevalence of EHV1 has been around for many years and has drove many research studies to allow us to attain properties about it, but has not been a fairly large concern to the health of our horses in the United States until about 6 or 7 years ago, when we had a large outbreak causing much distress to the equine community. Treatment since the outbreak in 2011 has been concern to many scientists because it is hard to find an antiviral drug to combat with the genetic makeup of EHV1. For quick worry relief to many owners, it was issued by many veterinarians to quarantine any suspected or diagnosed cases and ensure that tighter biosecurity measures are practiced in everyday activities. Although antiviral agents appear to be ineffective, potentially due to misdosage, the use of valacyclovir was recommended at combating the virus in a study presented at the International Congress of the World Equine Veterinary Association in November of 2011 by SM Reed DVM. The recommended doses of valacyclovir began at 27 milligrams per kilogram 3 times a day for a week, and then followed by the administration of 18 milligrams per kilogram 2 times a day for 14 days. Another approach that was being studied prior to the one by Reed above was a study that was done by Minke, along with others, with the use of DNA and ALVAC vectors with EHV vaccines that was published in May of 2006. In the study, they suggested that with ALVCA EHV1 in the presence of DNA plasmid that was formulated with aluminum phosphate, they saw an almost complete absence of the virus excretion in the group of horses in the study with this particular vaccination. Although more research was necessary to strengthen the stamina of the study, it was a promising approach for the EHV1 vaccine. So the prevalence in recent history that has brought the attention of many scientists to this disease was first noticed and published in JAVMA or JAVMA news article, which was published in 2007. Prior to 2003, there was little occurrence of the virus reported annually, and it was not around until 2005 that we saw a steep increase in reported cases of EHV1. In that article, it also states that in 2005, 7 outbreaks were reported in a total of 5 states nationwide. In 2006, 8 states across the country saw a total of 11 outbreaks reported that year. In 2011, the JAVMA Journal published an article in July about the detrimental outbreak that occurred from what was thought to have originated at the NCHA Western National Championships in Ogden, Utah at the end of April, beginning of May of that year. The article described the cases of EHV1 respiratory related and EHM were reported in 9 states and Alberta, Canada. Following the event with horses that had either been at the show or in contact with such horses. In an update released in June of that year, it was confirmed that an estimated total of 2,039 horses had been infected with the virus. 12 had died or been euthanized. What had been a little concern only a few years before quickly turned into a large biosecurity hazard for the equine community, and not only halted the proceedings of many events, but took many talented horses away from our community while it wreaked havoc. In this table, I suggested that we look to the championship show where the disease became more prevalent, and as you can see in the very left hand column, this chart is from 2011. It shows some of the major states and the number of horses exposed in Ogden, Utah. So as a total, it says 308, and so the next column would be our horses that may have had contact with those horses that were at the show, but not necessarily at the show themselves. EHV1 suspected cases are in the third column. Although many cases were suspected, the confirmed cases are located in the yellow column on the fourth and the fifth one over. Also, when EHV1 would mutate into EHM, the confirmed cases are 2 rows over from that. And the very last row shows our number dead or euthanized. So, since we live in Iowa, I thought I would look and compare the numbers from Iowa. And it shows that a number of 5 horses were at the Ogden show, and a total of 53 horses were secondarily exposed, but none of them were suspected of EHV1, nor were they confirmed in the case. So, as you can see, there are many states that had horses that were exposed in Ogden, but not secondarily exposed, and also secondarily exposed when they traveled back home that did not contract EHV1. As you can see also from the table, a number of dead or euthanized equine species was at a total of 7. So the equine herpes virus is a tough challenge for us to face, even though we already know so much about it. Mainly because finding a procedure in which can aid in the treatment is so hard to find. Because our current outlook on treatment for the disease is so vague, it makes the biosecurity measures within the horse community much more strict and alert to help prevent such catastrophic outbreaks across the globe. Along with aiding in safer day-to-day travel practices of health concerns, scientists will continue to find progress within the research studies to not only help eliminate some of the symptomatic effects of the virus, but help potentially rid the world of the virus outbreaks once and for all. Thank you for listening.